This is Angie Russell, NU 325, Section 801. This is my abdominal assessment. And we're going to scan the room. And this is my volunteer patient. Mr. Russell, do you consent to being videoed and the video being uploaded to my instructors for grading?
Yes.
Okay, thank you. See, there's nothing on the floor. Okay. All right. So I'm going to have you hop up on the table and we're going to have you lay flat on your back with your knees slightly bent. And the pillow up under you. Just try to get comfortable. And finish my hands. Hammer. Okay. So I'm standing on your right side. I'm going to go adjust the camera because it's pointed kind of down a little bit. All right. There we go. That's better. All right. So would you hold up your right arm? All right. I'm standing on your right side. And the first thing I'm going to do is I'm going to inspect your belly. So we're going to do this in a specific order. We're going to do inspection, auscultation, percussion, and then palpation. So the first thing I'm going to do is inspect. And so what I'm looking for are any herniations, discolorations, and I don't see any signs of a hernia. Your abdomen is flat. The contour is even. I don't see any distension. There is hair and it's evenly distributed. And it's a little coarse. Your abdomen coloration is consistent with the surrounding skin. I don't see any redness or rashes, skin lesions, scars. I don't see any drainage or swelling or redness around your umbilicus. Your umbilicus is midline and it isn't any. It's inverted. So what I'm going to do now is I'm going to listen for some vowel sounds with the diaphragm of my stethoscope. So I'll warm it up for you. All right. And so we're going to listen in all four quadrants, and we're listening first because we don't want to get any strange vowel sounds from pressing on your belly first. So we're going to start with this right lower quadrant and the right upper quadrant and the left upper quadrant and the left lower quadrant. Okay, so what I found was that your vowel sounds are normoactive, which means there's 5 to 30 sounds per minute. They are soft and gurgling or clicking sounds. And then if they were hyperactive, there would be more than 30, and they would be louder and have more of a gushing or tinkling sound. If they were hyperactive, there would be less than 5 per minute and they would be quieter. And then if I heard no sounds and suspected that you had absent vowel sounds, then I would listen for a full 5 minutes to determine if they were truly absent. All right, so now I'm going to listen to your abdominal vessels with the bell side of my stethoscope. So that's the smaller side. And I'm going to listen to your aorta, your renal arteries and your iliac arteries. So we're going to start with your abdominal aorta. We're listening for any bruits, which is the sound of turbulent blood flow. And now your right or left renal artery. Now your right renal artery. Now your right iliac artery. And your left iliac artery. Okay, so I don't hear any bruits in any of the arteries. Your right and left iliac, right and left renal, or your aorta. So now I'm going to percuss. And so what I'm listening for is how your belly sounds when I tap on it. So I'm going to use my little hammer and I'm listening for tympany or dullness. Tympany would be the presence of air. And dullness would be if I was tapping around something solid, like a solid organ or stool. And we do this in all 4 quadrants. Okay, let me get over here a little bit. Okay, so I hear tympany throughout your abdomen, and that's a normal finding. It would be normal to hear a little bit of dullness in some areas. That could still be a normal finding if I were over a solid organ or some stool. So now the next thing I'm going to do is I'm going to lightly palpate your belly. And so I'm going to just feel for muscle tone and any firmness or tenderness. And you just tell me if anything's tender. And we check in all 4 quadrants in a few spots. All right, did you feel any tenderness?
No.
Okay, so I did not feel any firmness, and all of your muscle tone was even across there. Your abdomen is soft, and I don't feel any superficial masses. So now I'm going to feel a little deeper with some deep palpation. So I'm going to press a little firmer, and you just tell me if anything hurts. Okay, did you feel any tenderness?
No.
Okay, so I didn't feel any masses in your abdomen, and I did not see any guarding or indications of pain, and I didn't feel anything abnormal. So now I'm going to feel for the distal portion of your liver, the distal margin of your liver here right under this rib. And so to do that, I'm gonna have you raise up just a little, and I'm gonna put my hand up under you. And now I'm gonna have you take, when I tell you, I'm gonna have you take a deep breath in, and I'm gonna press on and feel for your liver. Okay, 1, 2, 3, deep breath. All right. And now I did feel just the slight edge of the distal margin of your liver. So now I'm going to feel for that same area on your spleen. So I'm gonna have to reach across you and reach under just like I did. All right, take a deep breath, 1, 2, 3. All right, and I do not feel your spleen. That is a normal finding, along with sometimes feeling a little bit of that liver right there. So we're almost done. So I'm going to have you sit up, and I'm going to feel of your little margin in the back. Okay. All right, so I'm going to feel across the costal vertebral angle, which is right through here. It's at that bottom 12th rib where it meets your vertebrae. And I'm going to feel, and I'm going to tap there. And if you just tell me if it hurts, okay? So turn just right like that. Thank you. All right, you just tell me if you feel any tenderness. All right, same thing. Other side. Any tenderness?
No.
Okay, perfect. So that tells me that you're not having any CVA tenderness. And so hopefully there's nothing crazy going on with those kidneys. So now that completes my assessment. Do you have any questions?
No.
All right. Well, you can have a seat right over there while I scan the room again.